In this video by deck plate, we will understand the VA disability ratings for muscle injuries, the pelvic girdle and thigh, posterior thigh group, hamstring complex, biceps femoris, semimembranosus, semitendinosus, anterior thigh group, Sartorius, rectus femoris, vastus externus, vastus intermedius, vastus internus, tensor vaginae femoris, mesial thigh group, adductor longus, adductor brevis, adductor magnus, Gracilis, Pelvic Girdle Group I, Psoas, Iliacus, Pectineus. Pelvic Girdle Group II, Gluteus Maximus, Gluteus Medius, Gluteus Minimus. Pelvic Girdle Group III, Pyriformis, gemellus superior or inferior, obturator external or internal, Quadratus Femoris. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The muscles of the pelvic girdle and thigh are essential for core functions such as hip extension, knee flexion, and stabilization of the body. Injuries in this region can affect posture, gait, and overall mobility, influencing one's ability to perform daily activities. Each muscle group in the pelvic girdle and thigh has unique roles that contribute to hip and knee movement. Group 13th. Diagnostic code 5313. This group is involved in the extension of the hip and flexion of the knee, as well as the outward and inward rotation of the flexed knee. It works with the rectus femoris and sartorius muscles to coordinate simultaneous flexion of the hip and knee and the extension of both joints. Key muscles in this group include the biceps femoris, semimembranosus, and semitendinosus. Severe, 40%. Moderately severe, 30%. Moderate, 10%. Slight, 0%. Group 14th. Diagnostic code 5314. This group functions in knee extension, simultaneous flexion of the hip and knee, and maintaining postural support. The muscles in this group, including the sartorius, rectus femoris, and vastus muscles, Vastus Intermedius, Vastus Internus, Tensor Vaginae Femoris, work with the hamstrings to synchronize hip and knee movements. Severe, 40%. Moderately severe, 30%. Moderate, 10%. Slight, 0%. Group 15th. Diagnostic code 5315. This group is responsible for hip adduction, hip flexion, and knee flexion. It includes the Adductor Longus, Adductor Brevis, Adductor Magnus, and Gracilis muscles. Severe, 30%. Moderately severe, 20%. Moderate, 10%. Slight, 0%. Group 16th. Diagnostic code 5316. This group contributes to hip flexion, with muscles including the Psoas, Iliacus, and Pectineus. Severe, 40%. Moderately severe, 30%. Moderate, 10%. Slight, 0%. Group 17th. Diagnostic code 5317. The primary functions of this group are hip extension, thigh abduction, and elevation of the pelvis on the opposite side. It helps support posture by stabilizing the pelvis. Key muscles include the Gluteus Maximus, Gluteus Medius, and Gluteus Minimus. Severe, 50%. Moderately severe, 40%. Moderate, 20%. Slight, 0%. Group 18th. Diagnostic code 5318. This group controls outward rotation of the thigh and stabilization of the hip joint. It includes muscles such as the Pyriformis, gemellus, obturator, and Quadratus Femoris. Severe, 30%. Moderately severe, 20%. Moderate, 10%. Slight, 0%. Thank you for watching this video. Please don't forget to subscribe and like our videos.